Snoring is very prevalent among people across the United States. Snoring occurs when the soft tissues in the upper part of the airway vibrate. The vibration travels from the very back of the throat to the voice box. There is no cartilage and hardly any bone there, so the airway is only held open by muscle. When you nod off to sleep, your muscles relax. So, as you're breathing, those soft tissues tend to vibrate and cause you to snore. Snoring poses no real health risks for most snorers. However, people need to be aware that about 20% of snorers also suffer from sleep apnea, which can be a serious health problem. Fortunately, there are several things that can solve or at least mitigate the problem. What I would recommend trying first is to lose weight in order to reduce the excess fat in those tissues. Less tissue would mean less vibration. Another thing you could try would be to clear out your sinuses. It's very hard to breathe through your nose when you have congested sinuses. This can cause the tissues to vibrate even more and your snoring to be even louder. Sinuses can often be cleared out with medication, but if that doesn't work, there's always surgery. If you can get your sinuses cleared out, your snoring will definitely diminish. Snoring can also be caused by the position you're sleeping in. Many people find they snore more while sleeping on their back and less when they're sleeping on their side. For some reason involving the intricacies of the airway, the tissues vibrate more when you're on your back and less when you're on your stomach or side. Another thing you might do to solve the problem would be to try breathe right strips. The strip goes across the outside of your nose to pull your nasal passageways open. The result would be an increase in airflow through your nostrils, making it much easier for air to flow in and out through your entire upper airway. This would decrease the vibration and hence the snoring. As I mentioned earlier, approximately 20% of snorers have a condition called obstructive sleep apnea. If you've been diagnosed with sleep apnea, solving that problem would also cure your snoring. A CPAP machine is a medical device used for the treatment of sleep apnea. CPAP is short for continuous positive airway pressure. This is essentially a mask that is placed over the nose, or in some cases over the nose and mouth. The mask is connected to the small CPAP machine by a tube. The device blows pressurized air through the tube into the mask and on into the airway, keeping the airway open all night long to prevent sleep apnea and snoring as well.